Sexual behavior. This presentation is going to review sexual transmitted infections as well as sexual harassment, assault, and violence. Sexually transmitted infections are infections caused by sexual contact. Sexual contact includes vaginal sex, oral sex, and anal sex. The sexually transmitted infections can be caused by bacteria, viruses, or parasites. There are 20 million new diagnoses of sexually transmitted infections every year, and 50% of those are between the ages of 15 to 24. Of those 20 million, 24,000 women have undiagnosed sexually transmitted infections and become sterile each year. Also, only 65% of college campus students use condoms during sexual intercourse. Bacterial infections can be passed through all forms of sex and passed to the child during childbirth. Chlamydia is the most common sexually transmitted infection in all campuses across the United States. Symptoms for women include abnormal vaginal discharge, which may have a strong odor, burning sensation with urination, and pain during intercourse. If the infection happens to spread, it can cause lower abdominal pain and nausea or fever. Males with chlamydia infection can have discharge from the penis, burning sensation with urination, burning and itching around the opening of the penis, pain and swelling in one or both testicles. Gonorrhea does not always have symptoms. For men, it can cause painful urination and discharge. If left untreated, it can cause issues with the prostate and testicles. In women, it may cause bleeding between the periods, painful urination, and increased vaginal discharge. Syphilis has stages rather than symptoms for both males and females. The early stages are single small painless sores. If left untreated, it can cause a non-itchy skin rash on the hands and feet. Many people do not notice that they have symptoms for years, and symptoms can go away and come back. Bacterial infections can be treated and cured with medications. Those medications include antibiotics like erythromycin and azithromycin. Trichomoniasis, also known as trich, is the most common sexually transmitted disease that's a parasite. Many are symptom-free, but if symptoms do show, it usually happens between 5 to 28 days after being infected. For men, symptoms would include itching and irritation inside of the penis, burning after urination or ejaculation, and discharge. For women, symptoms would include yellow, green, or gray discharge from the vagina, discomfort during sex, vaginal odor, painful urination, itching and burning, or soreness of the vagina. Viruses is an infection that can be transmitted through all forms of sexual contact, and mothers can pass the virus to their children during pregnancy. Genital herpes is caused by the herpes simplex virus. 1 out of every 6 people between the ages of 14 to 49 have genital herpes. The herpes simplex virus will usually cause sores around the genitals. It can cause a smelly genital discharge and burning with urination. The symptoms are called outbreaks, where the sores flare up along the nerve that's infected, and the blisters become painful and then heal over time. Repeat outbreaks are common during the first year and tend to become milder over time. Human papillomavirus, HPV, is an infection that can show no symptoms and resolve spontaneously. There are also cases where the infection can cause precancerous lesions and warts. Nearly all cervical cancers have been caused by HPV. At this time, there is an HPV vaccination called Gardasil, but it has to be given between the ages of 9 and 13. Human immunodeficiency virus, HIV, is a virus that harms the immune system by destroying the white blood cells, which are responsible for healing and fighting infections. This increases the carrier for serious risks of infections. With HIV comes the risk of acquired immunodeficiency syndrome, AIDS, in the final stage of the infection. Not everyone who acquires HIV will develop AIDS. The first signs of HIV infection may be swollen glands and flu-like symptoms that may come within 2 to 4 weeks, and severe symptoms may not come until months or years later. With HIV and AIDS, since the immune system is compromised, it is not uncommon for patients to also develop syphilis infections. There currently at this time is no cure for viral infections, but there is an antiviral medication to reduce the effects of the virus to the body. Pelvic inflammatory disease is where infection spreads from the vagina to the uterus, fallopian tubes, or ovaries. This can cause, for women, possibility of being sterile or having pregnancy complications and miscarriages. Pelvic inflammatory disease can be caused by getting reoccurring sexually transmitted infections, or can be caused from having a sexually transmitted infection that goes untreated. Ladies, it's very important that if there is an unnatural odor or an unnatural discharge, that you come and seek medical attention as soon as possible. This activity is to demonstrate how easily sexually transmitted infections can be passed to sexual partners through any form of sex if protection is not used. Each cup represents a sexual partner, and the fluid in each cup is the fluid passed through sexual contact. Cup 1, the green fluid, represents bacterial infection, chlamydia. Cup 3, the orange fluid, represents viral infection, genital herpes. In cup 4, the particles represent HPV. Cup 2 and cup 5 are clear liquids, which represent no sexual transmitted infections. All 5 cups have not been tested for sexually transmitted infections, so the cups that have sexual transmitted infections have not been treated. Cup 1 has sexual contact with cup 2. So cup 2, who originally did not have a sexually transmitted infection, now has bacterial infection, chlamydia. Cup 2 has a sexual contact with cup 3. Cup 3, that had viral infection, genital herpes, also has chlamydia now. Cup 3 has sexual contact with cup 4. Cup 4, that had HPV, also has viral infection, genital herpes, and bacterial infection, chlamydia. Cup 4 has sexual contact with cup 5, again, that had no sexually transmitted infection, now has all 3 sexually transmitted infections: HPV, viral infections, genital herpes, and bacterial infection, chlamydia. That is why it's very important to wear protection when you're having sexual contact, as well as getting tested for sexually transmitted infections and getting the medical treatment needed. So as a recap, bacterial infections can be cured with medications. There's a vaccination for the HPV virus called Gardasil, but it has to be given between the ages of 9 and 13. Viral infections are with you forever. There are antiviral medications to reduce the virus in the body, but there is no cure for the virus. Some sexually transmitted infections do not show signs or symptoms, which is why it is important for regular testing. Pelvic inflammatory disease can cause difficulty with pregnancy or can cause a female to be unable to have children at all. It is your responsibility, if you have a sexually transmitted infection, to let your partners know so that they may seek the appropriate medical attention and get the testing that they would require. Also, please understand that some of the signs and symptoms of sexually transmitted infections can be similar to athletic-related injuries or other medical conditions. That is why it is important to report all medical issues to your athletic training staff immediately so you can get the medical attention that is needed. Here at Central State University, of the students that are tested, 2 out of 5 are positive. The most infective sexually transmitted infection on campus is chlamydia, but gonorrhea is at a 60-40 split. At Central State University, the HIV positive level is low, and at this time, more females are getting tested than males. Terms associated with sexual violence. Harassment is an act that uses power or privilege with intent to subdue actions or cause enough duress to lower the target's self-esteem. Sexual harassment is when someone touches you or asks you to touch them in a private area, even over clothing. It's also showing someone sexual pictures or objects, making someone feel uncomfortable. This can be interpreted as locker room talk, having a conversation with one of your friends in the cafeteria and someone else overhearing it. That can be considered sexual harassment. It can also be considered sexual harassment if you're having a conversation with a female and you put your hands on them because you're a touchy-feely kind of person, but they don't necessarily want to be touched. Sexual assault includes both forcible and non-forcible sexual offenses. Sexual misconduct is more of an umbrella term that includes domestic violence, sexual assault, and dating violence, as well as stalking. Stalking is conduct directed at a specific person that places fear into that person for his or her safety. And then you have hazing, which is an action taken of any situation created intentionally that causes embarrassment, harassment, ridicule, and risks emotionally and or physically harming members of a group team. They do not have to be new, regardless of the person's willingness to participate. Hazing can be considered having freshmen getting the equipment off the bottom of the bus. If it's something that they don't necessarily want to do, it can be considered hazing. Sexual assault is a serious matter. It can happen to anyone, anywhere, at any time. It can happen at any age, to any gender, to anyone of any disability, to any socioeconomic boundary. And every victim's experience is different and unique. No one can have the same experience. What can happen to you can happen to someone else completely different. Abuse can be emotional, physical, psychological, and sexual. There are various forms of harm that can occur in acts of interpersonal violence. Assault and battery is intentional hitting, striking of a person causing an injury. And aggravated assault involves serious bodily injury. So not only do you put your hands on someone, but you actually seriously harm them. Dating violence is when you have some type of violence with an intimate partner, but you do not live together. Domestic violence is violence occurring in a relationship where people are either married, they live together but they're not married, or they have children together. Dating violence, again, is relationship violence with a partner of someone you are not living with. Some examples could include physically harming a partner. It includes being emotionally abusive towards your partner, so putting that person down to keep them under your control. Again, it means you could be being controlling of that person, telling them where they can and can't go, who they can and can't talk to. Unwanted sexual interaction with that partner. If they tell you they don't want to have sexual interaction with you, that's the same thing as them telling you no. That can be considered dating violence as well as other things. Acquaintance date rape is sexual assault committed by a person that knows the victim. This can be a friend, a relative, someone you've been on a date with, someone that you work with, or someone you just recently met. Stranger assault is usually a one-time incident that occurs by someone that you have absolutely no idea who it is. So again, acquaintance rape, cousin, uncle, best friend. Stranger assault, never met them before in your life. Intimate partner sexual assault is sexual assault by someone that you are in a relationship with, either married or dating violence related. Same gender assault is assault by someone in the same gender as you. Drug-facilitated sexual assault is non-consensual sexual act when someone is under the influence of prescription, over-the-counter, or illegal drugs. Alcohol-facilitated sexual assault is non-consensual sexual acts that occur under the influence of alcohol. Either the victim or the perpetrator or both have voluntary or involuntary ingested alcohol. Drug and alcohol-facilitated sexual assaults are very serious. It's important that you take your prescription medicine as it's prescribed, as well as over-the-counter medication as it's directed. Also, make sure you're paying attention to labels and you're not taking medication that is not supposed to be mixed with other medications or alcohol. In regards to alcohol, this is where the alcohol and drug Marauder meeting really comes into play. We talked about staying in the green and knowing your limit. You have to pay attention to what you're putting into your body and how much. When you become too intoxicated and you're past your limit, it's easier to be taken advantage of with alcohol-facilitated sexual assault. So again, make sure you keep it in the green and know your limits. The law. Rape is a felony in the first degree. If the victim is compelled through force, threats, or controlled substances, it's not less than 5 years. Sexual battery is a felony in the third degree and is 1 to 5 years in prison. Sexual imposition is having sexual contact or touching of a person who's impaired. Sexual contact for the offender is up to 60 days in prison. Technology. 33% of young adults have posted either a nude or semi-nude content online. 59% of young adults have sent a sex message. Non-consensual distribution of an intimate image is where you have an intimate video or image of another person. It is not up to you to distribute that content. That content was sent to you in confidence from that person. You do not have their permission to send it any further than it going to you. In some cases, this can be deemed cyberbullying or revenge porn. Some examples of this would be taking a picture or receiving a picture of someone and putting it in a group chat with your friends. Not only would you be responsible for the photo, but then everyone in that group chat would be responsible for the photo that was posted because it was posted without the consent of the person the photo was taken of. More than 30 states have adopted penalties for non-consensual distribution of intimate images. If you're a part of a group chat and an inappropriate picture gets placed in the group chat, it is up to you to hold that person accountable. Also, understanding that web-based messages cannot be removed. So things like GroupMe, even if you delete the group message, can still be accessed because it's web-based. Same thing with WhatsApp, as well as Instagram, and even Snapchat can be brought back. Anything that's online, once it's put online, can be brought back again. If you or someone you know experiences sexual assault, please seek safety as quickly as you can and call 911. Find someone you can trust and feel comfortable to be with you. Get medical attention immediately. Even if you decide not to report the sexual assault, every victim should get a medical examination. Do not bathe, shower, change clothes, eat, drink, disturb the area where the assault took place. It is important to preserve the evidence if you decide to press charges against the offender. If an incident occurs, please seek help immediately. Do not wait. You can seek help from Title IX Coordinator, Ms. Ariella Brown, located at University Student Center, Suite 217D. You can also see Deputy Title IX, Ms. Jones, located in McPherson Stadium, Room 100. Contact Central State University Police and Safety Department. They're fully equipped to handle all sexual assault cases that occur on campus. Reporting a crime is very important, and reporting is not the same as prosecution. You can also report incidences anonymously in the Apple response box located in the lobby of the Beacom Lewis Gymnasium. Please make sure that you put the location, date, and time of the incident, and if you were a witness, all parties that were involved in the incident. Central State University Student Health Services refers anyone reporting a sexual assault to Green Memorial Hospital. Green Memorial Hospital provides medical care needed and also collects evidence for prosecution. Counseling services at the Student Health Center offer and provide confidential counseling for all students affected by sexual assault. You can also use the confidential emotional support crisis intervention by contacting the Ohio Sexual Violence Helpline. And lastly, you can seek assistance at Greene County Combined Health District. Please remember that you are not alone. 1 in 5 women and 1 in 16 men are sexually assaulted while they're in college. 1 in 5 women and 1 in 71 men are victims of sexual assault outside of college. More than 90% of sexual assault victims on college campuses do not report the assault. And nearly 1 in 10 women have been raped by an intimate partner in their lifetime. Reporting is serious. Rape is the most unreported crime. The prevalence of false reporting is between 2 and 10% in the United States. But that does not mean that if something does not go your way, that it is okay to false report a sexual assault. It is very serious and it can ruin people's lives if you false report a sexual assault because something is not what you thought it was or is not going the way that you want it to go. At the end of the day, only you have the power to speak up about what's happening to you, no one else. If you decide that you don't want anything done, no one can make you do it. No one can make you press charges. No one can make you file the sexual assault, sexual harassment, sexual violence charge. But please understand that you are not alone. There are plenty of people on this campus that are willing to help you and be there for you and do anything and everything to assist you through the process as best as they can to ensure that it goes as smoothly as possible for you. Central State fall testing begins the first week in September. It's Monday, Tuesday, and Wednesdays. HIV testing will be 1 to 4 p.m. by the health department, and it only takes 20 minutes. The dates are September 5th, September 25th, October 2nd, and November 13th. Know your status.